Advocacy visits. Advocacy visits is a part of the tools that is employed in community health services because community practitioners understand that government at various levels, at national, at state, at local government, and community levels, have a significant impact in health programs because these are political people and they have the will of the people and they their opinion count. So making a visit to them to mobilize them is important for any healthcare program to gain the effect that is expected. So after a healthcare worker or a community practitioner have carried out situation analysis, that is going into the community to find out what is actually existing and what is not existing, the situation of things. And also when the community practitioners have been able to carry out community diagnosis to find out, based on research, the actual problem of the people and look at other relevant documents and come up with best recommendation that is evidence-based. They now require the support of these people so that the program can push through because these people have access to the resources. The people listening to them because they are opinion leaders, they are political people. So that is why before a health program is initiated, they need to be aware. They need to be mobilized for them to provide their support, which is necessary for the health program to push through. And that is known as advocacy visit. There's levels of advocacy, such as at the national level, at the state, at the local government, and at the community level. So in this section, we'll be looking at advocacy visit. Advocacy is the mobilization of policymakers concerning health program or problem in a community. It refers to the process of engaging and influencing decision makers. These political people, this political class, these leaders are the decision makers in the community. As such, they are very vital for the acceptance, implementation, and evaluation of any health program or even a health problem. Let's say you conducted a situation analysis and said, this community required this healthcare intervention. You need to engage them for it to push through. Or let's say you carried that community diagnosis and you found out a health problem. You need to engage them so that the solution to that problem is identified and solved. So advocacy is a mobilization of policymakers concerning health program or problem in a community. It refers to the process of engaging and influencing decision makers to prioritize, support, and ideally implement health-related initiatives and intervention. Without the support of policymakers or government or opinion leaders, health programs that are beneficial to the people cannot push through. That's just one thing about it. But if you have their support, it will push through. So that is why you have to engage these policymakers. You have to mobilize them. Whenever you are carrying out a community health enhancing program, or when you have identified a problem and it needs to be solved, advocacy is key. You have to mobilize these people for them to give you their support because they are decision makers, opinion leaders, and can influence the decision and the implementation of the program. Advocacy can occur at various levels, at the government level, national, state, and local community. Let's look at steps in planning for advocacy. Before you engage these people, remember they are political class. They are persons that make decisions. So you have to get prepared so that whatever you are presenting will be evidence-based, because most of them are highly learned persons. So it should be evidence-based that no doubts would be thrown on during your presentation. So you have to make a good planning. So we're looking to look at the steps in making plan for advocacy visit. First, you will have to identify health issues. You will have to identify health issue. And how can you do that? You must have conducted an community diagnosis that will help you identify a problem, and also you have conducted situation analysis. It is important. You must identify a health issue that is a concern that reflects the fact needs of that community. You have to recognize significant health problems affecting the community. It could be high rates of obesity, diabetes, or mental health problem, depending. There's a lot of problem in the community. And that problem you have identified, you should have the data handy and must be through research. That is why community diagnosis is essential. You must have gathered evidence-based data showing the extent and the implication of the health problem you have identified. This is best presented in form of statistics on morbidity, that's disease, the number of disease burden, or mortality, number of persons who have died over time. Because during community diagnosis, you are going to review existing records. Then also look at the economic impact. How is it affecting the economy of that particular community, local government or state? So you have to have research. You have to have this data handy, and they must have come from research. And not only conducting this survey and research and having evidence-based data and statistics of that problem you have identified, you should also look up for best practices that will help in solving that problem. You have to develop specific recommendations based on thorough research and best practices. These recommendations should be narrowed to align with the community felt needs and real needs. That is where your core work is. You must have identified this problem, and you don't this a felt need or the express need of the people, or even the real need. Then what is the way forward? Because they are going to ask you, what do we do to solve this problem? Since this is our problem, and look at how it's affecting us, look at the number of persons that have been affected, look at how it's affecting our economy. Then what is the next thing? So all of these are under the first step, identification of health problem. When you have to say, we have to present that you have identified a problem based on the statistics, research, you have conducted true community diagnosis and situation analysis. Then you'll be able to relate to the people how it's affecting them. Number of persons who have been affected or who have died from the process, or who are suffering from the problem. Then the recommendations that are necessary to solve that problem. You have to get this ready before going to meet these people. That's the first step in the planning. The next step is identify health problem. Health issues. We have discussed on that, which can be a disease or health-related events. Health issues, this involves clearly defining the health issue that needs to be addressed and backed by data, like we said earlier. Thus, you must have conducted community diagnosis and situation analysis before proceeding with advocacy. So the first step is identification of health issues or health problem. So in the previous session, we looked at only health issues. Now we'll narrow it to health problem. So you must have identified health issues or health problem, and this must be backed up with relevant statistics. For example, you must have made an assessment of the local health statistics, revealing the situation on ground. For example, 30% of children in the community are classified as overweight or obese. It's a health issue that is at population level. The same way, it could be about 50% of the children had diarrhea in an interval of 1 month. It's a health problem. So whether it's a health problem or health issue, you have identified through community diagnosis and situation analysis, you should be able to present them using data, percentages, incidence, and prevalence. You have to really, even the case fatality rate, you have to have this handy if it's a deadly disease condition. Then have your recommendation based on um, um, global standard or the best practices. The second step is identify desired outcome. What do you intend to achieve? Yes, you have identified a problem and you have made us to understand the disease burden. Then you have outlined how we can achieve a solution to that. Then, in that particular problem, what do you intend to achieve? That is, identify desired outcome. So, what do you intend to achieve? That is known as the identify desired outcome. This step involves you outlining what you intend to achieve after the intervention. You have made a recommendation based on standards. So this particular step helps us to involves you outlining what you intend to achieve after the intervention. For example, using that of what the example above, the desired outcome for this problem in a particular community, what was seen on ground was 30% of children in the community are classified as overweight or obesity. It's a problem, right? So, which I've identified based on statistics. The next thing is, what do you intend to achieve? So, using that same example, the desired outcome could be to reduce the rate of childhood obesity in the community from 30% to 20% over a 5-year period. This is what you intend to achieve when you have put in place that recommendations. The next step is for you to select strategies for achieving the desired goals or outcome. For you to achieve a particular outcome, you must follow a series of steps for you to arrive at that. So you have to state the strategies for achieving the desired goals or outcome. Here, you state the methods or interventions you intend to use to achieve the desired health outcome, and this must be scientific. Example, using the example that we are working on, that is to reduce the rate of childhood obesity in the community from 30% to 20% over a 5-year period. Here are the strategies we intend to use to achieve that desired health outcome. Implement nutrition education program in schools. That's the first strategy. Second strategy is creating community garden projects to encourage healthy eating. Then establishing after-school physical activity programs. These are the 3 strategies we want to adopt for us to achieve that reduction from 30% to 20% in obesity among these children. The next step is you have to list tasks related to each strategy you have adopted. You can adopt up to 10 strategies. It all depends. Then in each of those strategies you have adopted, you have to list the steps that will help you achieve strategy 1. You have to list the steps that will help you achieve strategy 2. You have to list the steps that will help you achieve strategy 3. For example, this involves breaking down each strategy into actionable tasks and to ensure its effective implementation. Using that nutrition education program as strategy 1, what are the steps we need in order for us to achieve nutrition education program in schools, which is one of the strategies we want to adopt? 1, you have to think of how to develop curriculum with dietitians who will help teach these people, because you have to develop a curriculum that will be taught in school. but with the help of dietitians who will now give us the knowledge based on science that will now be taught among these school children when they're in school. Then the next step is after I've developed a curriculum based on the example I'm working on, train how to train these teachers to deliver the program in classes. Then schedule section with a school calendar. You have developed a curriculum with the help of this, the strategies you have identified is nutritional education program, fine. And the task that to ensure that you achieve that nutrition education program include one, development of curriculum with dietitians. You have to outline. Then once you are done developing this curriculum, what's the next thing? You think of, okay, how to bring these teachers that are teaching these children in this community so that they too will learn and be able to deliver that curriculum to the students so that they can learn. Then after you have brought them, the next is schedule a session with the school calendar. Within that school calendar, you have to schedule a session when this can be taught to these children. I don't really understand this because nutrition education program is a strategy we have adopted. But there are tasks that are required for us to achieve that strategy. One, curriculum development with dietitians to include required knowledge about dietary habits. Fine. The next is teachers that are going to teach these children, that are going to make use of this curriculum. They need to be taught on how to impart this knowledge in these children. Then, lastly, is how can they adjust their school calendar to capture this particular curriculum so that it can be taught to students. So these are the tasks under the strategy one. The same way other strategies that are tasks you have to think that can be adopted for us to achieve that. The next step is we have identified the task that will help us achieve the intervention or strategy. Fine. Then the next step is for you to identify among those tasks you have stated: curriculum development, schedule a section in the calendar, teaching of these teachers that will impart this knowledge. Which among these tasks can these policymakers help us to achieve? That's the next step. You have to recognize which specific tasks or actions require policymakers' involvement among all of this. Example, securing funding for the nutrition education program. This is where they come in. Yes, for us to develop a curriculum, we require people that will come, these dietitians that will come, leave their work. They have to come and you have to pay them. Therefore, we require funding. Then we have to also develop it in material that can be sent. The section for teaching these teachers, you need to motivate these teachers for them to come for that section for you to train them and pay them some allowance. So that means there's need for funding. This is where the policymakers are required. So one of their things is to help you secure funds for the nutrition education program from the local governments. And this requires actions of policymakers. These policymakers include governments, governors, local government chairman, local health authority, secretary, all that persons that can have access to fund at the local, national, or even at NGO level. These are all policymakers. So they will not help you. When they have understand what you want to do, they will help you and secure the funding that will help achieve this task. The next step, after you have identified the task that these policymakers will come in, you have to set objective for these policymakers in relation to that task you have given them, that you want them to intervene in. You have to set objectives, and those objectives must be smart. That is, should be specific, measurable, actionable, timely. For example, objective one, in relation to the task, you are given the task on funding. Then objective one in that funding task is, by the end of that particular year, they should be able to secure a minimum of 5 million naira in funding for the school-based nutrition program you want to start. That's the first objective. They should help you to secure 5 million naira in fund. This, they can do it because these people relate with non-international organizations. They relate with local organizations. They have access to government funds and all of that. Then the next objective is they can help you through members of House of Assembly in the state or LGA level to pass a legislation, a law that will prioritize physical health in school curriculum by the start of the next academic year. This is another objective they need to achieve based on the task. The first task you gave them is funding. The second task you should give them is how to get a law that will back up so that schools will adopt that curriculum you have developed. As such, the first objective is for them to get the funding for the training sections, development of the curriculum with dietitians. Then the second objective for them to achieve is for them to help you secure a legislation that will help the implementation of that new curriculum and other program. So this type of example we're using is a high power level. But at community level, there are other smaller ones you can do without requiring much hands and funds like that. The next step is select content and information needed by these policymakers to achieve that stated objectives. Yes, these people want 5 million naira and want the law to be passed. They need lots of information that will help them convince partners, NGOs, government to release that fund, and the legislation has to pass such law. So they require evidence-based information that will help them. When they go and say the House of Assembly will understand and accept it, then the fund will be secured from the international or local organizations. So this involves identifying what information is necessary for policymakers to understand and implement that objective effectively. Example, data on the community childhood objective rate. When you provide them with the number of children who are already obese and the likely complication in the nearest future, they will have a strong evidence to go and argue. You also have to provide them with evidence-based research on the efficacy of what you want to do. You have to state where this program has been implemented in the past and how and the result is that it has achieved. That is, you also have to provide case studies from similar successful initiatives in other communities. You have to provide them with this information so they can have a strong background of what they are going for. Then another step is you have to choose methods of communication to be used in giving this information to this policymakers because you have to convince them. You have to convince them. So you have to determine the best channel and means to convey the necessary information scientifically and persuasively for them to accept this objective and task. It could be through a town hall meeting. It can also be you sending reports for an urban community, sending reports, briefs through email or other online methodologies. If it's a local community, it can be town hall meeting, visitations, roundtable discussions, and all of that. Last step is for you to select a spokesperson or someone that will help you communicate, depending on the level of community you're operating. You have to choose a person who can effectively convey the message to the policymakers and stakeholders. Then inform the policymakers of the plan and the dates. You have to, or during that day, you will have to choose someone who will speak on your behalf so that they'll be convinced and be able to accept. Then you now inform them, the policymakers, of the plan you have and the date. So this plan, all we have stated is just the plan of action. You have to sit down and do this planning. Then once you're done with the planning, you now move. When you get there, you start implementing them. You will have to sit in with other healthcare workers, plan this advocacy visit because it's necessary for you to convince them. There is only when you go, if you don't go with this plan, you end up saying what may not even interest them or what may not capture their attention or what may, because some of these people are political persons. They want political positions and they need the vote of the people. So if you say something that they know that, yes, this is the problem of the people, that if it is solved through them, that the people will trust them and reliably vote for them for the next political years and all of that, they will give you their attention. They will support you because their interest is to secure the vote of the people. You understand? For those political minds. Then if it's for the community people, they will know that it's good for them and their people as such. When you speak something that captures your attention and not talking something that is not relevant, that is why it's necessary that you must conduct community situation analysis and community diagnosis, because they came from a particular community. If you come and say, this is their problem, they may have had clue, but you now have provided the problem and also giving them solution that is achievable. And they know that once it's implemented, things will work well. They will have no option than to support you. Now, let's look at what are the rationale for advocacy in primary health care. One, we know that the policymakers are usually in charge of funds in the community for carrying out activities. That is why we need to engage them. We also know that they make policies that may or may not favor a health program within the community. We understand that. They provide environment for a health program to take place. Also, it is important for us to equip these policymakers of their roles and responsibilities in relation to identified health goals. So these are the rationale for advocacy in primary health care. So in this section, we've been able to look at what advocacy is all about and the steps in achieving that. Then we'll wrap up with the rationale for advocacy in primary health care. And we'll use an example of obesity in a community, and we'll be able to give you. You can also apply this in a rural community where there is a high rate of malaria, and you tend to reduce the incidence. You also identify, because for us to reduce the incidence of malaria, we need mosquito nets, we need anti-malaria drugs, we need health education. When you list of those targets, your targets, what you want to achieve, you state the strategies that will help you achieve them, which could be malaria drugs, environmental sanitation, health education. Then in each of them, you state the task that's related. Then in each of those tasks, where can the policymakers come in? Let's take, for example, in that of the malaria, and the strategy is giving of prophylaxis to women. Then there's need for drugs. They can come in and help you secure the drugs. When you give them the required information they needed based on your survey and research and situation analysis report, they can go to these NGOs, to these government authorities, and secure all that is interested for you to achieve your desired objectives. Thank you.